Thinning hair and weight gain was just a fact of aging. My next guest says she refused to accept that diagnosis and instead found her fountain of youth. Please welcome the author of the book, Hormones, Health, and Happiness, Dr. Stephen Hotze, founder of the Hotze Health and Wellness Center. Also joining us is Joy Hall, one of Dr. Hotze's patients. My microphone's having some problem. Maybe it needs some hormones. All right, your name is Joy, but you were certainly feeling no joy at one point.
I was not.
What were you feeling like?
Well, my hair was falling out. I'd find it in the shower, on my clothing, and the bedding. I had a lack of energy on all fronts, and I personally had a little weight gain in my trunk area, and I knew there was going to be a better way of life.
Yeah, okay, so when all that was happening, what were you thinking? Just aging? Or when you find clumps of hair in the sink and in your bed and things like that, that becomes alarming to a lot of people.
I had a personal crisis that was going on for about 4 years. My husband was passing away with a terminal illness.
Wow.
I had a brand new baby and a career change and a move, and so I just thought that it was part of that.
Yeah.
But I realized after seeing Dr. Hotze that it was more of a physical issue.
Right. All right, Dr. Hotze, she said some key things there. One, high stress. The other is after having a baby. And a lot of us think we just have to accept that. What was really going on inside of her body?
I'm going to answer that question first, but I want you to know, see how pretty this lady is?
Yeah.
Did you know she was a merchant marine captain?
Wow.
For how many? For how many years?
12 years I went to sea.
12 years.
So you weren't used to being somebody who was tired and wanting to curl up and stay in bed.
No.
She sailed the high seas.
Wow.
Anyway, what happens after childbirth? Very commonly, a woman's ovaries, those are the organs that make women's hormones, are turned off during pregnancy because the placenta, the child, which the child controls, makes all the hormones for the pregnancy. Mm-hmm. And then once that baby's delivered, the placenta's delivered, you got to turn the switch back on. And the switch oftentimes in the ovaries just doesn't turn on, or it's not right. It's kind of low voltage.
Which is oftentimes you hear women say it's just not the same after having a baby, but we never ask why.
They say my metabolism changed, and so they gain weight, they get tired, their hair falls out because they have an imbalance in their hormones, which are their female hormones, which adversely affects their thyroid hormones, which governs your body's metabolism. Mm-hmm. So we see a decline and imbalance in the hormones.
It's a domino effect.
It's a domino effect, and it's very common. They go to the doctor, and the doctor goes like, well, you got to expect that. You just had a baby. What do you expect? You're going to look good again? Yeah, I'd like to look good again.
Yeah. Well, and Joy, what had people told you before? Was this the first place you went, or were other doctors telling you other things?
I had intended to go to a wellness center,
mm-hmm.
and as I was on a flight one day, I was looking through the magazine on board. I saw Dr. Hotze's ad in his clinic. I said, that's in Katy, Texas. I'm going to call him. I want to feel better. I want to accelerate my wellness.
Right.
I probably could have done something to alter my behavior or my diet myself, but I wanted to come up a couple of notches.
Yeah, yeah.
So it's fairly straightforward. All women make thyroid. All women make female hormones. All women make adrenal hormones. So it's a matter. So we have a program. It's a system of balancing out those hormones and replenishing those hormones. Right. That's what we do. So we, with Joy, she saw Dr. Ellsworth, I believe, replenished. Added some thyroid hormones. You know anything about thyroid?
Yeah, I do, because I had the same problem. I was told you're just getting old and you had a baby. So I was like, that's not working for me.
And it's very common after childbirth for women to become hypothyroid clinically, but the doctor doesn't recognize it because he relies or she relies strictly upon blood tests rather than the clinical presentation. And the blood tests are so broad and wide that everybody falls into the range of normal.
Yeah.
And a little thyroid hormone.
But I didn't feel normal. You didn't feel normal.
So anyway, a little thyroid hormone and some natural progesterone and some cortisol. Got you on an eating program, and I think you dropped a few pounds, didn't you?
I did. I lost 15 pounds, mostly in my trunk, where I intended to lose it.
No, but you look great.
She does.
So the point is, instead of treating symptoms, your point is to treat the cause. If what happened was your hormones changed, whether it's higher or lower, then you look at trying to balance it back out and make it like it was.
That's exactly right. You've got this down.
I lived it. I experienced it.
I ought to have you explain this to our patients in the office. I'm serious.
What you paying? No, but and the point that you want to make too, Joy, is to people: don't wait. If you're feeling this way, and again, we mentioned some of her symptoms. Are there some other symptoms also that people need to look out for?
This is the common things we see that women women's friends have in midlife. Fatigue, inability to focus, to think clearly, difficulty with weight in about 50% of the cases, cold hands, cold feet, hair falling out, the puffy, paleness.
Sex drive.
What? What's that? That's when they say, what's that? They don't have any sex drive or a loss of it. Insomnia, inability, brain fog, and then they get maybe depressed moods or mood swings. And and then they may get recurrent and chronic infections and yeast problems, and at least a host of other problems that become really very unhealthy. They don't feel well, but yet they can't find anything on blood tests that tells the doctor what's going on because he's not listening. You know, the old deal, he didn't understand, he didn't listen, did he? Well, that's right, you know, the boyfriend. Well, that's oftentimes doctors don't understand and don't listen. And if they would listen to you tell them their symptoms, if they would listen and put them together, they'd figure it out. That's thyroid, that's hormones.
Yeah, something that's very simple.
It's very straightforward.
To fix.
It may seem complicated, but it's not complex at all. It's very straightforward and simple.
All right. Well, Joy, we're glad that you've earned your name back. Now it's all about Joy. And thank you, Dr. Hotze. If you want to find out more information about Dr. Hotze and the Hotze Health and Wellness Center, you can call them. The number is 281-698-8698, 281-698-8698, or visit their website, drhotze.com. Dr. Hotze also hosts a local radio program, Health and Wellness Solutions. It airs Monday through Friday, noon to 1 p.m. on KSEV 700 AM radio. And you can also listen live online at drhotze.com. And again, a lot of information and answers in the book, Hormones, Health, and Happiness. Thank you.
Thank you.
Right after the break, we made